integrated service delivery is a strength-based model. What we are looking at is not the deficits. What we look at are the strengths, talents, gifts that the child brings with them, then understanding what the need is and pulling all of that into a plan in terms of how we then approach meeting the need.
I think integrated services are better for children and youth than working in silos, because really for children and families, they really don't care which department we work in. All they want to know is that we're there to help. So by us working together in an integrated way, we take off the jacket of where I work, and instead we say, what does this family, youth, or child need? And then we just jump in and do it. That's why I think it's better for children and families.
This is about the right intensity of service at the right time. This is about following the pathway of a child to service delivery, not the child trying to navigate multiple systems.
I think the difference is really being able to focus on the needs and the strengths of the family first versus maybe what our system's needs are or what we see as what we should be doing first. It really is changing the way we do service delivery for children and youth.
From a provider perspective, it's the opportunity for teams, integrated teams from the 4 departments to come together to collaborate on the work.
With ISD, what's really exciting is now all departments are collaborative. There's collective ownership, and you have the wisdom of all those professionals with the child in the center, and the results really we're seeing are outstanding.
Integrated service delivery brings everyone together in a coordinated fashion, and it mandates the support that needs to come around children, youth, and families. So it's much more effective because it's not individually relationship-based. It's a much more coordinated effort, and I think our collaborative work is much more effective.
Sharing of information is critical, and if we are going to deliver the right intensity of service at the right time for children and youth. So one of the things that we did was we passed legislation back in December of 2013, which now allows public bodies to share information as part of an integrated service delivery program or activity. What that means is that we now are able to share what is necessary amongst public bodies, oftentimes information that's already been gathered, that is already being worked upon with the family to ensure that we're coming together in an integrated common plan type of approach, and then approaching the child and the family and getting consent. But we want to make sure that when we approach the family and child, we're doing it in an integrated way that already starts to present solutions rather than them having to navigate multiple portals in order to get the services for their child.
The Network of Excellence is a whole continuum of services ranging from prevention to community-based services, including ISD child and youth teams, which may on occasion need to be stepped up to include specialized out-of-home treatment settings, such as the Center of Excellence for Children and Youth with Complex Needs, to address the addiction and mental health needs of children, youth, and their families.
What happens with the better communication is that everyone's on the same page. You feel like you're all flowing the same way. It provides a much more positive atmosphere of support for the child and the family.
It's just providing access is really just a simpler way of allowing service providers to meet the needs of the children and their families. It's making it less complicated for them, which is our main goal. It's easy access. It's, they come in and we wrap around the services around them instead of them having the responsibility to go out and find them themselves.
Having the child and youth teams draw on different disciplines makes for a richness in those teams that we wouldn't have had prior to integrated service delivery. When you bring together different professionals from different departments, they come with many years of training and experience and what they're able to share with each other and what they're able to provide in terms of services and supports, interventions to children, youth, and families and schools is quite amazing, because there's such a depth and breadth of experience and training there that we didn't necessarily have that prior to ISD.
Prior to integrated service delivery framework or model being developed, we did extensive research on what works. And clearly the research was saying that you're going to get a bigger bang for your buck if you work together. and you work together in an interdisciplinary team approach. It provides the opportunity for multiple professions to work together to ensure that we're exchanging knowledge, talents, and gifts in those teams, and also making sure that we're having the opportunity to work together to share amongst the team what is the right intensity of service for that child.
The supports that the child and youth team members can provide to the ESST is immense. They can work individually with teachers, they can run groups at the schools, they can provide supports at all 3 tiers of the pyramid of intervention. They certainly can do consultations and individual one-to-one interventions with students. So the capacity for those team members to provide supports to the ESST and the school as a whole is great.
So when you're looking for strengths, you're really going to look to the child and family and the community supports they may have in place. Things that maybe we don't necessarily see as a strength to them, but they see as a strength. You know, it could be a neighbor, a friend, the janitor at the school, a grandparent, a coach. Is to really look at the supports that are wrapping around this child.
Most important thing for me is that we know that we are reaching more children, youth, and families than we have ever been able to reach in the past.
Such a positive interaction, collaboration, and it's so wonderful to work in that kind of a situation that it's like night and day.
What we want for sure is that nobody gets lost in the system, so that regardless which person they go to, they can get access to that service.